Last week, we had a great introduction to infodemic management and what infodemic is from our colleague Chris Cerniak from WHO Geneva. I thought that I would actually complement that presentation, but really perhaps speak to you from a perspective of someone that I've worked as a health information analyst, as a health informatician, and I've really worked for many years in Europe at the intersection of health information, digital health, and decision making. So I thought perhaps I would give you a little bit of a perspective, because last year when I worked for WHO, I was actually pulled into the response, like probably many of you, into the infodemic response and risk communication pillar of COVID-19 response. But with my background, I had a different perspective and I brought different skills. And I wanted to sort of motivate you to also think about how we need to start making connections between preparedness and response for infectious disease and actually health information systems and evidence-informed policy. So I will, however, discuss a little bit about the infodemic, just for those of you that weren't here last week. Now, some think that the infodemic is really only a problem of online misinformation, and Petronil presented really nicely what the infodemic is. Experience in epidemic response over many decades now has really shown us that in times of an epidemic, we experience a surge of information and rumors, and that includes misinformation. And as Petronila said, this happens in online and offline worlds. These rumors and infodemics really aren't new. What we've learned from past experience during outbreaks is that the infodemic's harmful impact make it much harder to control the epidemic and manage epidemic risk. So we've learned that it doesn't really have a direct impact on health or just cause confusion. Really importantly, it also exacerbates mistrust in science, in health authorities, and in public health measures. And it also has wider societal impacts, such as stigma or loosening of social cohesion. And this is the connection to public health that I will keep coming back to. Now, the infodemic has been high on the mind of countries since the very beginning. I think we've all experienced it in our work over the last year and a half. And we've also seen this in the international fora. So member states have been concerned about how to manage it in the context of COVID-19, and it has consistently been raised in WHO and UN forums, also by European member states. Now, also, the thinking about what enables a more nimble response to a pandemic. When we're thinking about that, it's been recognized that better actionable insights are critical. So we do not only need better and nearer to real-time monitoring of disease and epidemic risk, but we also need to have better and more real-time understanding of acceptance of public health and social measures and of the infodemic. And this is, I put here as a photo of the announcement that Germany, together with WHO, is actually opening a global pandemic and epidemic intelligence hub. But really, it also, I think, in my opinion, redefines what epidemic intelligence is and actionable insights are. Now, this is, in my opinion, key. Infodemic management really supports management of epidemic and the epidemic risk. You see here a bit what I was describing earlier. During an epidemic, we apply different types of interventions. They can be pharmaceutical, they can be epidemic management tools, public health social measures, etc. who tried to suppress the epidemic curve. And during all of that time, we also experience the infodemic. And of course, that means that health system that is responding has experiences different stressors. So infodemic management, in a sense, supports the response. Especially with the enactment and introduction of public health and social measures, we rely on the public, on people, to enact health behaviors. And I'd like to stop here a little bit just to point out something that is probably quite obvious to all of us, but it creates definitely complexity in how we need to think about infodemic management. Now, for a while in the past, we've thought that as long as someone is going to receive the right message about protective measures, they will take appropriate action. But really, what drives people's behavior is a lot more complex. Not only, and especially during the times of an emergency, where we experienced just even more than usual information overload, cognitive overload. We're busy with other things, not just thinking specifically about how we can protect ourselves. And then, of course, the type of information that we receive is of varying quality from a variety of sources and media. And even if we receive the message, we actually still don't know exactly what are the factors that influences, well, what are our decisions on intent to do something. And then even when we take action, when people take action, the actual behaviors may not be protective or may even be harmful. So just delivering messages, we've learned, is really not enough. But at the same time, I put here together two things that I think we've kind of learned that have challenged all of us professionally in whatever capacity we've been working in public health substantially over the last year and a half. Now, one thing is that really the risk communication, crisis communication, communication with the public is really influenced by the public opinion. So even our communication with policymakers is highly dependent on communication with the public and the formation of public opinion. So policy and public opinion feed into each other in a cycle. So public opinion exerts pressure on the policy makers, policy layer. This puts pressure on government, which sometimes suboptimally communicates and acts. And this can then erode public trust, which then contributes to weakening of the collaboration and compliance with public health and social measures, and that again generates even more pressure on policymakers. And this is definitely something that has been exacerbated or we've experienced a lot over the last year and a half. Now, and the second thing to consider is also on the side of the community engagement. We've really been challenged with the need to think more broadly. So most effective communication with people has been when it happened where people were, where we were intently listening to people's concerns, but also we were interacting with people where they were. And that can be anything. So in the States, so outside the US, this was, for example, in online parenting and alternative medicine forums online or on Reddit. And across the world, also, it was in conversations with librarians, healthcare workers are a big partner in communicating with communities. But we've also seen innovation in, for example, working together with employers and unions, professional industries, and similar, specifically looking at how to communicate best ways that different settings can protect themselves. And I think we're going to hear a bit more today about this. Now, however, I would say what we've also learned is that we need to broaden the perspectives of what are the types of actions that we need in order to respond to the infodemic and to manage it. So we have approaches in communication that have now over the past year also been complemented with more social behavioral approaches for example, behavior change communication. But just those two aren't the silver bullets to managing infodemics either. And why not? Because the way that we live and behave in our everyday lives is influenced by the information ecosystem that we live in. And I mean here the physical and online environments where we present ourselves as friends, as hobbyists, as discussants, experts, parents, brothers, sisters, so on. So the information ecosystem, we receive information and we interact with others. We trust. We listen to people who we trust, whether they're online or in our everyday lives. And when misinformation is also, when we receive misinformation from people that we trust, we are more vulnerable to it. Similarly, as for example, how outbreaks occur in communities because we trust each other when we see each other. So I have here just a slide that was recently presented at the WHO Infodemic Management Conference on Social Listening, where really just to illustrate, and I won't go into the detail here. You can look at the link that I referenced here. We interact with even just on the online information ecosystem. We interact through a variety of channels. Some of them are more public, like Instagram and Facebook, and some of them are really closed communities, like in Telegram. And what we really learned is that well-tailored and good messages won't save us anymore. Even the best message nowadays can be weaponized and misrepresented, and it can jump from one platform to another without us having any control over by just looking in a specific part of the information ecosystem. So this is why our analysis, when we think about how we even design interventions, our analysis really needs to emphasize narratives, not individual messages online. And this map of all online conversations that I'm showing here across multiple social media platforms, this really shows that ideas jump from platform to platform, and we see on the what we see really ourselves on platforms, social media that we use, or even Google search engines. That's presented to us very personalized by algorithms that wish to grab our attention. And we, in a sense, live in our personalized individual information bubbles. So that's one challenge. And at the same time, just by looking at this, you can sort of see, well, then actions to take down content or ban people from one social media platform, they don't really address other linkages, and they also don't really address why we're vulnerable to misinformation in the first place. So one thing that I wanted to sort of, and I'm segueing now into the 4 takeaway messages I think that we as public health authorities need to think about, is that, okay, if people live in and we all live in this information ecosystem, how do we even go about trying to manage that and addressing infodemic risk, harm from the infodemic? there are many other actors that influence and interact in this ecosystem. There's fact checkers. We heard from a talk last week. Then, of course, there's us, and we have a certain mandate and role to play in an emergency response. There's journalists and media. There's international organizations, WHO and UN, for example. We have EU private sector, not just social media platforms, but other types of private sector involved, civil society. And I would also argue, and there has been quite a lot of discussion about the role that research community and scientific journals, what their role is in helping to manage the infodemic and the type of information that circulates and is discussed online. So the first takeaway message that I would suggest that we need to think about is that we need to partner up with fact checkers to help us correct misinformation and the media to amplify these corrections. So these are called debunks in the language in the world of fact checkers. But really, I think that's the minimum really in thinking that we need a whole of society and everyone in our professional and personal lives engaged and thinking critically about how we can address this issue. What we can also do is we can partner up with science communicators and journalists to better report on health information. All of this is not new. There were initiatives that have been in place pre-COVID-19 pandemic. But what we're realizing is that all of our professions need to add more skills and next evolution of thinking. We also should make connections with civil society, for example. Civil society is self-organizing, and we can partner with them to promote community resilience and action. So I think, one thing that I'd like to point out is that the public health perspective really needs to be heard loudly in discussions, especially when it comes to regulation of access to health information, regulation that responds to misinformation or that criminalizes spread of misinformation, regulation of social media platforms, and things like artificial intelligence algorithms and related analytics. And that means that we as public health professionals are challenged to really learn about this and have a position about this. And the discussion in Europe has dealt a lot with disinformation, for example. But the bigger challenge in management of epidemic risk and of the infodemic is actually misinformation. And this hasn't been really discussed enough, in my opinion, at the European level. This aspect needs to be heard. This aspect from public health needs to be heard when policymakers discuss policy response, so that we complement, for example, public awareness campaigns and strategic communications methods, also with tools and methods and techniques that address factors such as trust and social cohesion, things that would help us. The second takeaway that I'd like to put in is that we shouldn't be afraid. I was a health information specialist that supported risk communications colleagues, and we all got a crash course in each other's skill sets last year in the team. And we shouldn't shy away from the fact that because this problem is so complex, we do need to embrace multidisciplinarity. We need to really, we know that we need to actually leverage a lot of different skills. We need to know how to act within this information system. We need to know how we can characterize it, analyze it, how we identify where interventions should be targeted for highest public health impact. We need to know how to make sure that we put capacities and systems in place so that we can use a prepared infodemic management toolbox to respond. And we really need extremely diverse perspectives to work on this. Especially because the science of infodemic management is in its nascency, it's really in its infancy. And the emphasis on systemic approach and analytics and thinking and decision making really will come to fore even now, even more when we move out of this acute phase of COVID-19 response and really start looking at, well, how do we strengthen our systems and what do we learn from this? Maybe here as the second point that I mentioned here, you know, epidemiology, if you look at it, it has a history of several centuries, and it has leapfrogged maybe the last 150 years, especially the last 50 years, in its methods, in qualitative and quantitative methods to build an epidemiologist's toolbox. We really can leapfrog a lot if we lean in on and really take advantage of the expertise and the methods that and the tools that we already have in different professions. So I won't go into a lot of detail here. I feel very passionate about this, but this is why I'd like to bring home the message that I really think that the principles from health information systems, from population health monitoring, really needs to be brought into infodemic management thinking. Systems building, we are, for example, being comfortable with new data sources and methods of data collection, being comfortable with and how does one integrate analysis into practice. Ultimately, I'd like to say that humans interpret dashboards and integrate information. There's no magic dashboard that will solve our problems. And we are also stakeholders in the new indicators and metrics that will actually support better analysis, better modeling of epidemic risk, better evaluation of interventions. And this is difficult. The indicators that we need to look at is social cohesion and infodemic risk. What drives behavior change in physical world if we only have, for example, data from the online world? Things like that. I dropped this slide in just to illustrate to you that actually, to a certain extent, every country has been dealing with the infodemic and the shock that it has caused over the last year and a half. This is results of a survey that WHO conducted in the first quarter of this year. Not that many respondents from the WHO European region, only 16, but really 2/3 of countries have a report globally that they've designated a team that tracks and addresses infodemic and health misinformation. That's huge. It's something that that exists outside of organizational structures, but it's a function that is being recognized as needed, as essential. And USCDC, to my knowledge, is the first health authority that has established an infodemic insights unit so far. I unfortunately don't have a lot of time to discuss what I think actually is needed and is essential to really start fitting infodemic insights into health authority processes. This is something that myself and a colleague from USCDC started working on as a framework approach to infodemic management for public health last year. And I have here 2 references where you can listen both to videos and read my blogs on the topic. But you know, what's clear is that a lot of these activities that I show here as the pipeline are being done by colleagues, sometimes in different units across health authorities, sometimes even outside of Ministry of Health or Institute of Public Health. For example, social listening and delivering high quality health information, so risk communication and community engagement. But what we also need to really emphasize is bringing this much closer into a systematic way of thinking, integrating these insights a lot more closer into the response of the health system. So this is not just a matter of emergency response, but really integrating into capacity of the health authorities and really thinking about how we build resilience to misinformation at individual, community, and societal levels. What I think actually is that different countries have emphasis on different.
Could you wrap up, Tina? Thanks.
Yes, different functions here, but we really need to work together to define this a little bit further. And then as far as the last slide that I wanted to show is actually thinking from one of our European health information colleagues, Neville Kalea from Ministry for Health Malta, where he really actually is pointing out that we now are building science for more evidence-informed response, not just to communicate about what is worrying and responding to what is worrying the population, but also and what is weakening the population. So there's actually quite a lot more need for a lot more integration between how we currently look at population health and health information analysis and what until now has been more the domain of risk communication. So I'll stop here. Sorry, I can speak forever on this, but hopefully this was interesting for everyone.